Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Schistosomiasis, also known as Bilharzia, is a disease that affects millions around the world. It's a parasitic infection, meaning it's caused by a tiny organism that lives inside the human body. While it can be controlled with medication, understanding its causes and symptoms is crucial. This knowledge helps us protect ourselves and others from this potentially debilitating disease. Schistosomiasis is often found in areas with poor sanitation. This is especially true in parts of Africa, South America, and Southeast Asia. Anyone can get schistosomiasis, but children are especially vulnerable. This is because they often play in contaminated water, increasing their chances of infection. Schistosomiasis is caused by a parasitic worm called a schistosome. These worms have a complex life cycle that involves both humans and freshwater snails. Let's break down how this microscopic enemy spreads. People become infected when they come into contact with freshwater infested with schistosome larvae. These larvae are released from infected snails living in the water. The larvae are incredibly small and can penetrate human skin that comes into contact with contaminated water. Once inside the body, the larvae travel to the blood vessels where they mature into adult worms. These worms live in the veins around the bladder and intestines depending on the species of schistosome. The female worms lay eggs which are passed out of the body through urine or feces. If these eggs end up back in freshwater, they hatch, releasing more larvae that infect snails, continuing the cycle. The initial infection with schistosome larvae might go unnoticed, as early symptoms are usually mild. However, as the worms mature and lay eggs, the body's immune response kicks in, causing a range of symptoms. A rash and itchy skin, known as swimmer's itch, can occur at the site where the larvae penetrate the skin. Fever, chills, and muscle aches are common a few weeks after infection, as the body reacts to the parasite's presence. As the worms mature and lay eggs in the intestines or bladder, pain, discomfort, and changes in bowel habits are common. Blood in urine or stool is a more serious symptom that indicates damage to the bladder or intestines. Section 4. Unmasking the culprit, diagnosing schistosomiasis. Diagnosing schistosomiasis involves a combination of understanding a patient's travel history, evaluating their symptoms, and performing specific tests. Travel history. Doctors will ask about recent travel to areas where schistosomiasis is prevalent. Stool and urine tests. Examining stool and urine samples under a microscope can reveal the presence of schistosome eggs. Blood tests. Blood tests can detect antibodies that the body produces in response to the parasite, confirming the infection. Section 5. Shielding ourselves. Prevention of schistosomiasis. The good news is that schistosomiasis is preventable. By taking some precautions, especially when traveling to or living in areas where the parasite is common, we can significantly reduce the risk of infection. Safe water practices. Avoid swimming, bathing, or washing clothes in freshwater sources that might be contaminated. Opt for treated water for drinking and other household uses. Protective clothing. When wading or working in potentially contaminated water, wear protective clothing like boots and gloves. Travel smart. If you're traveling to areas where schistosomiasis is present, consult your doctor about preventive medication. Section 6. Winning the battle, treatment, and outlook for schistosomiasis. Treating schistosomiasis typically involves a short course of medication that effectively kills the adult worms. Early diagnosis and treatment are key to preventing long-term complications. Praziquantel. This medication is highly effective in treating schistosomiasis and is usually administered in a single dose or over a few days. Follow-up care. After treatment, follow-up stool or urine tests are important to confirm that the infection is completely cleared. While schistosomiasis can have serious health consequences if left untreated, the outlook for most people is positive with prompt medical attention. By understanding the causes, symptoms, and prevention strategies, we can work together to combat this global health challenge. UMCC, your ultimate medical consultant connectors.